the letter that I wrote to the Wall Street Journal, where I said that based on the research that Niran and I have done for our book, we could really uncover no credible studies involving the care provided by nurse practitioners or physician assistants that showed safety and efficacy without physician involvement and physician supervision. And that's true for every single study included in the Cochrane database of those 18 that you pointed out, Phil. And Dr. Mundinger has responded saying that's not true because the one I did was involving independent nurse practitioners. But what we're explaining here is that the nurse practitioners in the Mundinger study were, number one, receiving much more training and education than a typical nurse practitioner. Two, they were receiving patients that were referred from physicians already diagnosed. Three, they were practicing in New York State, which had a requirement for a collaborating physician, which meant that nurse practitioners could always call upon a collaborating physician for help. And there was a certain requirement that I believe collaborating physicians had to review a certain number of charts or spend a certain amount of time with the nurse practitioners that they worked with to have that agreement and licensed. Does that all sound about right, Niran?
It does. And I guess I would just add that each of the nurse practitioners selected their own collaborating MD. So they got to pick them. And then she makes a point of saying that the nurse practitioners were well served by the arrangement because a physician would have responded immediately if medical assistance was required. And finally, anytime they were admitted to the hospital, there's an entire protocol written that the physician had to see the patient and sign off on the orders within 24 hours. And interestingly enough, the pediatricians actually that were part of this study, if a pediatric patient needed to be admitted, they insisted on co-admitting. So in that case, it was a real supervisory approach. It was less collaborative and more supervisory when it involved sick pediatric patients. So again, like I think Phil has alluded to, that even her letter to the Wall Street Journal seems to have some misleading pieces to it. When you really delve into the details, it really wasn't an independent study. And I would still stand by what we said in our book, which there have been no credible studies that have evaluated unsupervised or free practice nurse practitioners with full practice authority, and comparing that to a standard clinic in primary care. And the question is, we need that data. That's what
it's really interesting because this study that she references is now about 20 years old. Mm-hmm. And there has been independent practice in many states of the country for quite a number of years at this point. So you would think that by now there would have been time to put together that data, but yet I haven't seen any published data that has been well done that demonstrates safety or efficacy of nurse practitioners or PAs practicing independently without directly working with a physician or having access at least to a physician.
Yeah, especially when you're talking about the gold standard, which would be randomized controlled, blinded studies. And obviously, this is actually, I think, the only one that even came close. And obviously, when you delve into the details, like we've talked about, it really isn't an independent study.